On this video, we'll discuss important anatomical findings of adrenal gland on cross-sectional imaging. This is a clinically based questions. You can pause a video after each question to give you a chance to think and answer. Question number 1. On cross-sectional imaging, the right adrenal gland has a constant relation to IVC. This relation is anterior, posterior, posterolateral, or anteromedial. On this non-contrast axial CT, at the level of the IVC is located anterior to the adrenal gland, which is indicated by the red arrow. While in the early post-contrast, the same relation is found between the IVC indicated by the blue arrow and the right adrenal gland. Also, when we check axial T2 MRI of the abdomen at the level of adrenal gland, we can notice the characteristic signal void pattern of the IVC, and there is the same relation between the IVC and the adrenal gland. So, the answer of this question is choice B. The right adrenal gland has a posterior relation to IVC. Question number 2. Regarding left adrenal gland, which statement is true? The left adrenal gland has a posterior relation to aorta. The left adrenal gland located anterior to the upper pool of the kidney, or it lies above the upper pool of the kidney, or located anteromedial to the upper pool of the kidney. On this axial CT cut of the abdomen, we can notice that the left adrenal gland has anterior and medial relation compared with the upper pool to the left kidney. It's not completely anterior and it's not superior to the upper pool of the left kidney, but exactly at the anteromedial position. So, the right answer of this question is the left adrenal gland located anteromedial to the upper pool of the left kidney. Question number 3. The body thickness of adrenal gland shouldn't exceed 10 to 12 mm, 5 to 6 mm, 3 to 4 mm, 1 to 2 mm. The adrenal gland has a body and two limbs, medial and lateral limb. The second part of the gland is a body and shouldn't exceed 12 mm, while each limb, its width about 3 to 5 mm. So, the right answer is choice A. The body thickness of adrenal gland shouldn't exceed 12 mm. Question number 4. Which statement is true? On CT, the left adrenal gland is visible on the same slice as the upper pool of the left kidney, or the right adrenal gland is visible on the same slice as the upper pool of the right kidney, or the cortex represents 10 to 20% of the adrenal gland. The right adrenal gland vein drains into right renal vein. On this axial CT image, we can notice that the left adrenal gland has anteromedial position to the upper pool of the left kidney, and on the same time it appears on the same slice. While on the right side, we can notice the right adrenal gland has a superior relation compared to the upper pool of the right kidney, so it usually doesn't appear on the same slice. Thus, the right answer of this question is choice A. The left adrenal gland is visible on the same slice at the upper pool of the left kidney, while choice B is not correct because the right adrenal gland has a superior relation to the upper pool of the right kidney, so it usually doesn't appear on the same slice. Choice C, the cortex represents 90% of the adrenal gland, not 10%, And choice D, the right adrenal gland vein drains into IVC, while the left adrenal gland vein drains into left renal vein. Question number 5. Both adrenal glands are embedded in fat, located in the perinephric space, within the pararenal fascia, or all the above choice. Both adrenal glands are retroperitoneal structures. The right adrenal gland lies behind the IVC, while the left adrenal gland lies behind the pancreas, and both of them are embedded within the low-density fat component, and at the same time located in the perinephric space and the pararenal fascia. Thus, the right answer of this question is choice D, all of the above. Question number 6. Which statement is true regarding the signal intensity on MRI of the adrenal glands? On T1 and T2, both adrenal glands are low in signal compared with adjacent fat, or on T1, both adrenal glands are of similar signal intensity to spleen. C. On fat suppression sequence, both adrenal glands are difficult to identify, or D. The choice A and B. On this axial MRI images, T1 and T2 image, the peritoneal and retroperitoneal fat exhibits high signal intensity on T1 and T2 sequences, while both adrenal glands, either in T1 and T2, exhibits low signal intensity compared with the adjacent fat. And on the same time, their signal intensities are similar to the spleen, either on T2 or on T1. Thus, the right answer of this question is choice A and B. Question number 7. Adrenal glands have a characteristic shape on cross-sectional imaging. This pattern is linear flattened shape, comma shape with a comet tail, or inverted V or Y shape, or it has discoid pattern. We can notice this is the coronal images of MRI and on reformatted CT image. Both adrenal glands have a characteristic inverted V or Y shaped either in CT or even on the MRI. So the characteristic pattern of the adrenal gland is inverted V or Y shape, and so the right answer will be the choice number C. Finally, this is a take-home message for the important points we have discussed. Please read it carefully and till we meet again on the next videos. Thank you.